had the privilege of writing the NHS Future Forum report on integration. And what's really interesting for me is that you've managed to span a big gap that very few people manage to join up. And it's the gap between the big, ambitious, attractive vision of a better future and where I am as a GP working in a busy GP practice in the centre of Manchester. I tell the story of how when we last decorated our consulting rooms, I had to clear stuff off my shelf and came across this weighty tome of the local public health strategy, bought into by the local authority, the fire and police people, education and the NHS. I helped to write it, and yet you could tell by the dust I had to blow off this document that even I hadn't returned to this grand vision of the future in the 3 or 4 years since we published it. It's a really depressing and rather a sorry, oft-repeated experience. I think what's really different about the work that you've been doing is that you've found ways through or over a lot of the hurdles that create that polarisation and that sense of paralysis. I think there have been some different foundations laid at the start of your transformation journeys, which have really been very effective for you, and then kind of run as slightly to mix metaphors, run as a golden thread through a lot of what you've done. And if you look at the NHS change model, putting unashamedly this concept of our shared purpose right at the heart, I think that's absolutely right. Where you take the time and the effort together to create the sense of who we are, who is the hour round here, who needs to be round this table, to be sharing, identifying the common values, the common ambitions that we all have, and allowing that just to do its work naturally. I don't think I've yet seen an example of where there hasn't been a strong emergence of a purpose for change and an agreement for change and a clear direction and energy for that change. It's not enough on its own. It doesn't come easily. It sometimes doesn't come quickly. There will be, in some cases, shouting. There will be some clenched teeth. We've had experiences where there have been some tears. But once you do it, once you put in the work of creating good foundations, I think we are seeing CCGs and their alliances building shared purpose, which is really driving something quite exciting and quite new. One of the challenges that I think healthcare around the world is facing, it's not just the NHS, is that the next frontier is not so much about building new structures. It's not so much about new technologies. The new things we need to do are actually new relationships and new behaviours. And they're relationships and behaviours on the part of nurses and therapists and doctors and administrators and leaders and managers and the individual people we serve and their carers and their families and their communities. And if we can't build new and better and more productive relationships and behaviours, then frankly all of the plans, all of the structures, all of the new financial incentive schemes in the world aren't going to help us through what is a quite fundamental set of changes if you compare what we have to do now with what we were set up to when the NHS was founded. So where are we then in terms of making a reality of this? Well, John has referenced the 5-year forward view, and you can't have failed to notice that some of the big things in there are about new models of care. And two of those that have attracted most prominence and are probably going to be the features of the most activity are multi-specialty community providers and primary and acute care systems. And one of the things I think is really exciting but incredibly challenging about both MCPs and PACs is that they start by saying we as the NHS have something incredible in our model of primary care. British general practice is, in a sense, one of the jewels of the NHS crown. It's the bit of the NHS around the world that most stands out and that people are most interested in finding out about and emulating wherever possible. It's also one of the bits of the NHS that I think has been most constrained in releasing its potential over recent years. And I think the constraints have grown worse, partly because the needs of the people we serve have grown and changed qualitatively as well as quantitatively. And partly because, as we all know, investment in general practice has not kept pace. So we end up in a situation where we're talking about primary care being the solution to all sorts of things, but we find that we don't actually have enough people working in it. And some of the premises are really not fit for purpose, and that they have no headspace or time to come to the meeting. It doesn't matter how much they believe in what you're trying to do, we don't fund general practice to allow general practitioners to come to your meeting. Some of the work you've been doing, some of the foundations you've been laying, need fundamentally to go into general practice. But there's more in terms of the challenges of delivering this. And this is a, very, very bullet list sort of summary of the capacities and the capabilities which we think are necessary in order to help primary care providers rise to that challenge or be part of your grand vision for the future. It's quite a big list, isn't it? And on many of these, the starting point of these GP practices in terms of their current capacity or capability is really, really low. It's really low. Even those who say, our foundation, our federation, our network has been in existence for years, are really exploring the limits of their capacity and capability. They're really finding there are some big gaps. And so one of the challenges to commissioners who are talking about delivering something better for their population is, what are we doing to build into those gaps? What are we doing to build the capacity and the capability of those providers to do exciting new stuff? And then there's some other questions as well. I think that's probably the biggest challenge. And I'd like to ask you what you're doing as you look to the future to build those capacity and capability gaps. How are you adopting a continuous approach to this? It is really common, and we've all had experience of doing this, to create a kind of a set it and forget it approach to a strategy. We wrote our strategy document 6 months ago, it's been ratified, we're now just getting on with delivering it and doing it. It'll just happen. In the world of complexity that we actually live in, that you're actually commissioning in, set and forget strategy lasts about 3 weeks, if you're lucky, before something major is out of date. We also have a tendency to revert to type in terms of our preferences for how we continue to enable and drive change. You'll have your personal preferences, your team will have its habits, and you'll have your culture. But actually, if we ossify a strategy, or if we don't continue using every part of the NHS change model to drive change, you're going to run out of momentum. The second thing is, if you stick with just the same core team, you're likely to run out of momentum. And those of you who've been kind of engaging and reading up on some of the background reading to this programme will remember the model of large-scale change and its encouragement to start somewhere, but don't stay there in terms of who's on board, to continuously spiral outwards and outwards. Some people prefer snowball as a metaphor, but to continuously recruit more people in to be part of your change programme. And then the last thought is much more of a personal one for you as leaders and for your teams. And it's about the journey and the energy. When you look at the history of large-scale change efforts, one of the sort of depressingly common findings is a loss of energy, a diminishing of momentum over time, fizzling out over a period of 18 months, 2.5, 3 years. When things are slowing down, we either say, let's get the data out there, let's find out more, let's publish the data and show that things are tailing off, that'll motivate people to change, or we say, just come on, everyone be more busy, everyone work harder, come on, come on, come on. Nothing wrong with those, but if it's all you rely on, you might become one of the people who tails off over 18 months to 3 years. Actually refreshing the sense of togetherness, refreshing this, what they call it, the social energy, is really powerful. Stepping back, looking back to your distant mountain and refreshing the spiritual energy of your purpose is also really powerful. It costs nothing. It's usually very quick to do. You can do it in 10 minutes at the start of a meeting. Just remind yourselves about why you're doing it. And again, encouragingly, the evidence shows you're far less likely to run out of energy. So as we celebrate today, I hope it's not a resting on laurels. I hope as you kind of start talking to each other now across the room, you're going to be sharing encouragement and challenge about what next, who next, how, and also that you're refreshing one another's energy continuously. And actually, wouldn't it be great if we met up again this time next year and see how much we got achieved? We've set some great ambitions, I think, in the 5-year forward view, but it'd be great if we could actually make them happen. And that is, as John said, entirely up to you.